as a 20 to 30-year-old, the first thing is to get some basic baseline blood work, see where you're at, check your family history, see if there's certain conditions that are relevant that we need to be a little more cautious, especially in your 30s and 40s, especially your 50s. Dad or mom may have the medical condition that developed at 50, so we need to be aware of that.
Welcome to another episode of Clear Light Connections, where we talk to the people behind the businesses in Bay Area, Houston. Proudly sponsored by UTMB Health. Today I have with me Dr. Varghese,
Hi.
who is a family practice practitioner, a doctor of family practice. I don't know the exact term. And we're going to talk about men's health because June is Men's Health Month. So just start us off with, why is Men's Health Month? Why is it so important?
Well, here's a scoop about it from the Cleveland Clinic survey. 3 out of 5 men don't get a physical. 40% go to a doctor only when there's a serious problem that comes up. And 50% of men, when they see the doctor, they don't talk about their health. And about 19% only go to a doctor because their significant other or spouse have told them to do it and they want to get them off their back. And, a lot of people agree with the adage, if it ain't broke, don't fix it. However, if you look at the statistics, we see that men are much sicker and live less than their female counterpart. CDC shows about 20%, men over 20, about 13% are without health insurance, 50% still smoke, 30% have drank about 5 drinks or more at least once in this past year, 50% have blood pressure issues, and 60% are overweight or obese, which you guys see from the pandemic, so many health problems.
Yeah.
It's important.
So what would you say are like your top 3 or 4 things that men of all ages really need to keep an eye out on?
One is their weight. One is to check their stress level, which is kind of hard because you can't really quantify it, but that's something so important. The other one is sleep, and then what they're eating and what they're bringing to their body.
Ooh, I'm feeling pretty bad right now. Hey, can you make me look slimmer, Garrett, please? Okay, I only want to have 3 of those risk factors, not all of them. So, anyway, we talked about really you need to start in your 20s, right? I mean, so what would a 20-year-old need to concern themselves with when it comes to their health?
I think the basic thing is to build a relationship with the physician. Most of the men that I see, they're in their 40s, 50s, and 60s, and they haven't established with the physician. So there's someone that they have built a relationship with. That leads to a lot of issues. A lot of trust issues, especially when you're not seeing someone for the first time. It's extremely hard to build anything. And for someone that's in their 20s, if they can build a relationship, they can feel comfortable, they can start expressing their concerns and fears. And hopefully, by building a relationship, they'll be more open and we can catch things early before they become a problem.
Yeah. And I got to admit, I'm guilty of this. I had a doctor that retired, and I never found another one. I mean, I still went to a cardiologist and some specialists. Uh, So yeah, you're right. It's something that just happens. Time catches up with you, and the next thing you know, like in my case, I'm 50. So now that I'm 50, I've kind of pledged to myself I need to do all those things I said I would do. What are those things I need to be doing?
Well, for you, you're already behind the curve. You need a colonoscopy, which is not 45, used to be 50.
Oh, okay.
So that's just a couple of weeks ago. But that's one important thing because colon cancer is such an important thing and we're catching it early. We're seeing so many problems with it and it needs to be done early nowadays. And that is an important aspect. The other one is checking your cholesterol panel, seeing where you're at. That can help give risk satisfaction to see where you're at in terms of a risk of a stroke or heart attack in the next 10 years. And if diet and exercise, where you're at with that, and if a cholesterol medication could be benefit for you in terms of preventing complications.
So let's say I came to you and we went through this, and uh, I know in the past I've had doctors where I just felt like they were pushing medicine really
Mm-hmm.
quick. And so tell me, what would your kind of approach be that might differ from that?
Yeah, and I think for medicine, it's not just medical aspect. There's actually a lot of components to it. To me, I view it more of the spiritual, the emotional, the physical, and the mental aspect. And those are all the components that are important for overall health. And if you focus on one aspect, that in itself is an incomplete picture, an incomplete part of the puzzle. There's more to it. And we have to focus on all these different areas to actually affect health outcomes in a positive way. So I address actually the other components as well. And I think with that combined together creates a better outcome. Medications help, but they're a band-aid. They're not the solution.
Right, right. So it's you're treating a symptom, not the actual cause.
Exactly. You're
Okay.
putting a band-aid over the situation when you really need to get to the underdwelling issue and kind of treat that part. But to get there, you need help. And medications, if indicated, can help you while you work on all the other aspects and get you where you need to be.
Yeah. So, uh, you brought it up a little bit about colon cancer.
Hmm.
What are the main kind of cancer awareness things that men need to look out for? You mentioned that one.
Colon cancer is one. Prostate cancer is another one too, especially at age 50, unless there's risk factors in the family where you need to do a bit earlier, especially male side. So something to talk about family members. Oftentimes, I see a lot of men they don't know their family history, so asking their fathers, their mothers about family history is important. So prostate cancer is one thing we can definitely screen for and check for and catch early. Um, a After a while, the other things too are making sure we look for heart disease and other issues like diabetes and screen for that as well.
Okay.
Yeah.
And so, what are they like? We've already established men are stubborn and
Mm-hmm.
they don't take care of themselves maybe the way they should. So when it comes to those particular cancers, what warning signs should they really be paying attention to and say, okay, enough is enough. You need to get to the doctor.
Well, I think for anyone, listen to your body and see what's going on. If you feel there's something not right, you're right. There's probably something not right. One of the most common things we see with cancer is we find it when it's too late and there's too many symptoms come with it. So screening is the first step and catching it before symptoms arise is the solution. However, I see people with unintentional weight loss or they start feeling really fatigued and tired out of all of a sudden. Those are kind of warning signs that I usually see or that bled in the stool, blood in their vomiting sometimes. Serious things that, kind of throw off for a couple of months and then
Yeah.
you come in and it's
That
not
that would
good.
be hard to ignore. I mean,
Yeah.
if you see that, yeah, you have to know there's something wrong and you got to get it taken care of. Now you mentioned, and I don't know how we're going to work this in, but I'm due my colonoscopy because of my age. Happy birthday. So do I go to my primary care physician can I go straight to a specialist? And when do I make those distinctions?
Yeah, that's a great question. Our modern healthcare is more fragmented. There's more to it now. I mean, with new treatments, it's all sophisticated. So we do need specialists because of all that. However, primary care is the front line. The primary care doctors can definitely set you to the right people. With regards to the colonoscopy, they can set you up and order the study right there, and then they can call you up and get it scheduled. Unless there's something in your medical history that needs you to see the GI doctor,
Hmm.
they can do it that way. And there are other options for the people that are averse to the colonoscopy, like Cologuard or the FIT test, which are things that you can do at home and mail in and out and do it. But the best gold standard, the best way of detecting colon cancer is colonoscopy.
Yeah, I won't
Yeah.
know if I'm averse until I try, right?
Right.
Um, so eh, why do you think men have such a tough time talking about some of these sensitive issues? Like, for example, erectile dysfunction, other urinary tract things. What makes men so hesitant to bring that up with their doctor, and how should they approach that with their doctor?
Yeah, it's a difficult subject to talk about. We're not. It's hard to talk to a stranger about it.
Yeah.
Hard talk to, kind of hard to talk to family about it, but harder to talk to a stranger. So I think that's a big thing. You don't go to your friend and just talk about these kind of things. You kind of want to kind of bring it up kind of innocently and kind of
Mm,
bring it up. And I see a lot of patients I say, well, my wife wanted me to ask you about this. And that's a segue into the situation. But I think the key is to build a relationship with the physician. If you can build a relationship where you feel comfortable and confident enough to ask what you want to ask, you can get it done.
yeah.
And these are all medical conditions that can be treated in a lot of ways. And so the thing is to feel comfortable, I think. And
Yeah.
that's hard.
Yeah. And so how do you build that rapport? How do you build that relationship with your patients?
Yeah, I think it's just like dating or friendship or even a spouse. It takes time. It takes years into it. You had to see them multiple times to see that. The best way is to talk to your family and friends, see who they see. Because chances are, if you kind of are similar to them and they connect with a physician, you may also connect with them.
Hmm.
And if you see them over a set point in time, continuity of care, you're going to get better at your own health outcomes because they're going to help you get there. As a primary care doctor, our job is to educate, and we can educate you on your health conditions so you can be a more powerful advocate for yourself. With more knowledge, more power has come to you to take care of your health in a better way.
So I'm going to ask you for like your top like 3, 4 tips for men's, what they need to be doing. But first, I have to go to Sherry Sweeney with some important announcements from the chamber.
Hello, Clear Lake Area Chamber of Commerce members and Bay Area Houston. If you're a small business owner and have thought about maybe joining the chamber, August is the time to do it. We call August My Chamber Month, which means that you can come visit chamber activities throughout the month to see how much we can do for you. A lot of networking will happen inside August, including the Business and Wellness Expo, speed networking, which is kind of like speed dating but more towards business. So there's a lot of different activities just for you to experience being a part of the Clear Lake Area Chamber of Commerce. Go to clearlakearea.com for more information.
All right, and we're back. And so I was asking you about, I need some tips. Maybe break them down into the different age groups. What are the tips that are really gonna, I think, keep people keep men especially at their premium, their highest fit levels, health levels. So and I'll make this about me. I'm 50, and I want to know what I need to do to get to 70, 80, maybe even 90.
Yeah. So the first thing is establish care. As a 20 to 30-year-old, the first thing is to get some basic baseline blood work, see where you're at, check your family history, see if there's certain conditions that are relevant that we need to be a little more cautious, especially in your 30s and 40s, especially your 50s. Dad or mom may have the medical condition that developed at 50, so we need to be aware of that because when you turn your 50s, we need to be really mindful of that because that could happen at that age.
Yeah.
You know, um, as a 20, 30-year-old doesn't mean you gotta come every single year. And if relatively healthy, you can go every 2, 3 years, but at least initially established. In 30s and 40s, we're kind of checking more for the obesity and diabetes and high blood pressure and really checking that. And each year, the blood pressure is such a crucial thing. Something as small as that, we can notice it being caused by a lot of things, stress, medical conditions. And if we can address those other things, we can really prevent strokes and heart attacks. In the 50s, really checking about colon cancer and prostate cancer screening, and we're really screening for cancer. Um, what we're trying to do is not to treat conditions, we're trying to prevent them. And by doing it early, we're catching things before they become a problem. Because the worst thing is no one wants to go to the doctor all the time. You don't want to be going there every couple of months,
Yeah.
The best thing is to come there once a year, but in order to do that, you got to be consistent. You got to go there at least once a year, get these basic workup done, and see where you're at, and build from there. Go from there.
Yeah. And so I've been making this list in my head. Some of
Mm-hmm.
them you talked about, I know. Okay. I didn't realize I was 5 years late on one of them. On the other, I realized it was 50. But I'm trying to figure out which doctors I need to see
Mm-hmm.
for kind of quality of life issues. I've got a hip that's arthritic. My shoulder. So explain to me the process you would go through if I come to you as a patient talking about, let's address those things that are going to make your life better or your quality of life. So quality of life issues.
And that's the key. The key is to get good quality of life. That's what everyone wants, and that's why as physicians, that's our main focus. In order to do that, especially with someone with hip problems or any kind of arthritis issues, the first assessment is to see what's going on there. Get the history. Do a physical exam. Actually tease out what it is, because it might be a muscle issue. It might be something that can be fixed without surgery. It might be physical therapy. It might be some exercise that you can be taught from the clinic that you can do. Sometimes you use certain medications to help put a band-aid while you work through exercise to strengthen those areas there. However, there's some kind of concern, especially if your shoulder's having issues, that might be a rotator cuff tear. We can do it and then get the right imaging ordered and get you seen by the orthopedic doctors in order to get the surgery, if indicated, done quickly, and also save you time and money.
Yeah. I like saving time and money.
Yeah.
So, um, tell me about UTMB and how it's grown in this area. And just basically, you have such an extensive network. And to an old guy like me, it seems like it popped up overnight. I know it didn't, but tell me a little bit about what you've experienced and how UTMB is kind of not just growing, but it seems to be flourishing.
Yeah. Well, my mom actually worked at UTMB's Andy department as a nurse here, and that's how we actually came. We're from New York, and we moved down to Texas a long time ago. I'm pretty much Texan because I've been here all my life. But
Yeah.
and so I've seen it grown from a young age all the way to now. And I went to medical school here at UTMB as well, so I've seen it when they before Jenny Seeley came about and all that, and the leadership currently is phenomenal. Dr. Raymer has done a phenomenal job. He's one of the most caring people out there. He cares about patients. He cares about employees, and his leadership is really shown in terms of UTMB and how it's grown right now. And especially during the pandemic, it's been phenomenal what he's done and the whole leadership there. And it's just remarkable. I know him personally, and he's been such a father figure to me, and I've just been. And that's one of the reasons why I came back to UTMB, and it's grown everywhere. You got one of the greatest educational areas here. They have some of the best trained medical students and residents of all fields, and they're just leading healthcare in this area here. And we're really blessed to have such a great, wonderful team of so many people here involved, whether not just be physicians, but with our nurses, respiratory therapists, physical occupational therapy, nurse practitioners, everyone here as a team. It's just been remarkable PAs. So.
Yeah, and you bring up an interesting point, and I don't think people realize that UTMB is such it's an education institution, and people forget that. They just think of it as a hospital. So, but it's cool to see that your mom worked there, and you're a local product, and so you stayed. So, do you live in the area?
Yeah, I live in Lake City.
Okay.
So I've been here all my life.
Okay.
Went to high school here. Not too far from college, but yeah, medical school came back. It's phenomenal.
Okay. Awesome.
Yeah.
So, which high school did you graduate from?
Clear Horizons.
Oh, okay.
Yeah,
Fantastic. Yeah, I love that program.
yeah,
So that really kind of propelled you and got you an early start on college.
yeah. And then I was and UTMB gave me an early spot to medical school, so I got that opportunity. So it was phenomenal just to be close to home and be here, and glad to be back from. I trained in Tyler, and so this Northeast Texas, and I got to be a part of the UT system there, and we have a little connection there with the medical students being sent there. So I had a lot of connection with UTMB. So and I always been drawn to UTMB here, but a lot of the mentors and just phenomenal peoples out there. Dr. Kaiser, the county health inspector,
Hmm.
he's been a great mentor as well, and a lot of people in the UTMB system from all the people that I interact as a medical student are still working here, and it's just awesome to see them and see the impact they have on medical students because that makes a big impact.
Yeah. So we like to talk about buying the Bay Area a lot,
Yeah.
local, staying local, keeping local. And your story is the perfect buying the Bay Area story. You grew up here and you've come back to, ply your trade and you did your schooling here. That's awesome. That's great to hear.
Thanks. Yeah. I
So,
love it. I love this area. It's a
yeah.
great area.
So before we go, any last words you want to tell us about your practice or men's health in general, or anything else you'd like to add to the conversation?
Yeah, I'm accepting any patients, new or old. I want to work with people. I know a lot of it is building that trust, and a lot of patients have lost trust with other physicians or other primary care providers. It's understandable, and I want to make sure I work with them to get them where they want to be and want to restore their health and wellness. And I want to approach not from a medical standpoint, but also from the spiritual, emotional, and mental health standpoint, because those are such important aspects of health outcomes. And then for health, men's health isn't just for the man. It affects their spouse, it affects their daughters, their sons, their mom, their sisters, their brothers. It's all their health is important to everyone else.
Yeah.
And if they start taking care of themselves, it's going to make a big difference for everyone else because we need them there.
Well, thank you for coming, Dr. Varghese. It's been great. And thanks for everything you do.
Oh, appreciate it. Thank you.
All right.